Welcome to The Explainer. Today, we're getting personal. We're going to dive into the fascinating and, sometimes controversial science of you, how psychologists actually measure the very thing that makes you, your personality.
Okay, so let's start with a basic truth. Everyone has a personality. And the thing is, it tends to be pretty stable throughout your entire life. Whether you're shy or the life of the party, those are core parts of who you are.
But that's the real puzzle, isn't it? How in the world do you take something as slippery as a person's attitudes, their values, their style, and turn it into cold, hard data? You can't just use a measuring tape for this.
Well, the way psychologists get a handle on it is by breaking personality down into its basic building blocks. They call these traits. Think of them as those core qualities, like being shy or outgoing, that pop up in your behavior again and again.
So, once you have these traits in mind, how do you measure them? Well, it turns out there are two totally different schools of thought on this, which has led to two very different kinds of tests.
First, you've got what are called objective tests. They use really clear, direct questions like this one. There's no trick here. The thinking is simple. Your answer is a direct reflection of that trait. What you see is what you get.
And then you have the other side of the coin, projective tests. These use things that are intentionally vague, like the super famous Rorschach ink blot. The whole idea is that you'll project your own hidden thoughts and feelings onto the image to make sense of it, and in doing so, you reveal a part of yourself.
So you can see the huge difference here, right? Objective tests just ask you straight up, and the scoring is standardized. It's by the book. But projective tests, they're all about interpretation, both from you and from the person giving the test, who has to be highly trained to score it. And you can bet that this subjectivity has caused some massive arguments in the field. It's even led to some classic jokes, like this one, that really hits the nail on the head. It makes you wonder whose mind is actually being analyzed here.
So you might be wondering, how do they even come up with these tests in the first place? It's not like they just write down a few random questions. The process is actually pretty clever.
One of the most powerful ways to build a test is something called the criterion group approach. Basically, you come up with a giant list of questions. Then, you give them to two different groups. Let's say one group with a specific clinical diagnosis and one without. The only questions you keep are the ones the two groups consistently answer differently.
And a perfect real-world example of this is the MMPI, the Minnesota Multiphasic Personality Inventory. It's one of the most widely used personality tests on the planet, and it was originally created by finding questions that psychiatric patients answered differently than the quote-unquote normal group, which, believe it or not, was made up of University of Minnesota undergrads.
Okay, but what if you don't start with two groups? What if you just want to let the data speak for itself and tell you what the basic ingredients of personality actually are? For that, you need a seriously powerful statistical tool.
It's called factor analysis. Now, it sounds complicated, but the basic idea is pretty simple. Imagine you have test scores for a bunch of different reading skills. Factor analysis is like a magnet that pulls related items together. It notices that scores on, say, comprehension and fluency are linked, and it groups them into a single underlying factor we could call reading ability. It's all about finding hidden patterns.
And what happened when researchers did this for decades with tons of different personality items is kind of amazing. They found that thousands of different traits could all be boiled down to just 5 fundamental factors. And you've almost certainly heard of them, the big 5 personality traits.
Okay, let's switch gears a little bit. So far, we've been talking about personality. You could think of that as the brain's software. But what about testing the hardware itself?
Well, that's where the field of neuropsychology comes in. Neuropsych tests don't ask you how you feel. Instead, they give you specific tasks to measure cognitive skills, like memory or language or problem solving. It's a way to see how the brain is actually functioning, especially after an injury or if a disorder is suspected. A really classic example is the Stroop test. All you have to do is say the color of the ink, not read the word itself. Go ahead, try it. It's way harder than it sounds. That's because your brain's automatic response to read the word gets in the way of its task to name the color. It's a genius way to measure what psychologists call executive function.
So, we've talked about all these different tests and techniques, but we have to ask the big question. Why does any of this matter? Where are these tools actually being used?
The short answer? Pretty much everywhere. These tests are used in some incredibly high-stakes situations. We're talking about huge corporations trying to hire the right people, hospitals trying to make accurate diagnoses, courtrooms making legal decisions, and even dating services trying to find your perfect match.
And the reason why a test is being given can completely change the game. In a therapeutic setting, you're the client. The whole goal is to help you. But in a forensic assessment, say for a court case, the client isn't you, it's the court. And the goal is to help the court figure out the facts, whether you like it or not.
And that brings us to a really big question we need to think about. As these tools get more and more precise at defining the very core of who we are, who gets to see that information? Who owns that data about you? And who gets to use it to make decisions that could change your entire life? That's a question the science can't answer on its own.